All aboard! In this DermatOgraphix voyage, we set sail to Melon Crab Island. This island is rich with the treasures and secrets of melanoma, hence the name Melon Crab Island. But before we get there, let's focus on the fun in front of us on the cruise ship. Here, we'll go over the subtypes of melanoma. We first encounter the superficial raft, the dermatographic symbol for superficial spreading melanoma. Superficial spreading melanoma has a long horizontal growth phase, kind of like the raft moving horizontally in the water. On the raft, a shirtless man is rowing away, highlighting the subtype's predilection for the trunk in men, while a woman shows off her legs, showing its common occurrence on legs in women. Next, we witness a nodular rocket being launched vertically. This is our symbol for nodular melanoma, which has a rapid vertical growth phase. This man came to party. The man in the astronaut helmet shows us that nodular melanoma commonly occurs on the head and neck. The helmet is black and blue, which is a common appearance of nodular melanoma. The astronaut is a male, as nodular melanoma more commonly affects males. As we venture further, dark algae floating in a tank introduces us to Lentigo Maligna. Just like algae grows in the sun, Lentigo Maligna grows in chronically sun-damaged sites. The algae's irregular shape and dark color reflect the common appearance of Lentigo Maligna with irregular borders and dark color. It is floating in the water, signifying the long horizontal growth phase of Lentigo Maligna. Hey yo, this cruise ship is lit! They even have a Bob Marley. Bob Marley has a dark spot on his palm, representing Acral Lentiginous melanoma, the same melanoma that unfortunately took Bob Marley's life. This is the most common melanoma in darker-skinned races, which we can also remember with Bob Marley's skin tone. He also has a black nail and a shirt that says Hutch, highlighting that nail matrix can also be affected and is associated with the Hutchinson sign. This disco dancer is living life on the edge of the cruise ship. The disco dancer represents Desmoplastic melanoma. He ain't no cheap dancer. He's got a $100 bill, reminding us that Desmoplastic melanoma is S100 positive. His funky socks indicate that Socks 10 is also positive. He danced so hard that he broke the melon with an A inside it. The broken Melan-A is a reminder that Melan-A is negative. This hummingbird tried to eat the broken melon and died. The dead hummingbird is there to show that Desmoplastic melanoma is negative for HMB45. This woman got a watermelon seed stuck on the roof of her mouth, introducing us to Mucosal Melanoma, which predominantly affects the hard palate. She's holding a stopwatch because the most important prognostic factor is early diagnosis, because this melanoma will metastasize in 50% of cases. Check out this dude who just turned 21. He's spitting out a watermelon, representing Spitzoid melanoma. He's enjoying a pina colada with a straw shaped like the number 9. Putting it all together, he symbolizes the homozygous loss of 9p21 in Spitzoid melanoma. He tossed a fish overboard to remind us that this is detected by fish. The fish is sad, as this mutation is associated with the poor outcome. Finally, Gina. She represents GNA11 mutations, and she's holding a GNAC snack to represent GNAC mutations. She's using eye drops to represent uveal melanoma, which is associated with these mutations. A bat is flying by, indicating a high risk of metastasis if concomitant BAP1 loss occurs. She also has a pet blue crab, symbolizing that malignant blue nevi are also associated with GNA11 and GNAC. Let's wrap this up so we can unwind on the island. The superficial raft symbolizes superficial spreading melanoma, with the raft's horizontal movement across the water being a metaphor for its horizontal growth phase. Shirtless man highlights the subtype's predilection for the trunk in men. The woman showing off her legs shows it is common on the legs in women. The vertical rocket launch represents nodular melanoma, characterized by its rapid vertical growth phase. The man in the astronaut helmet indicates nodular melanoma's common appearance on the head and neck. The helmet's blue and black color is a nod to the typical color of nodular melanoma nodules. He is a male, as this type of melanoma has a higher prevalence in males. The dark algae floating in a tank introduces us to Lentigo Maligna melanoma. Just like the algae grows in sunlight, Lentigo Maligna grows in chronically sun-damaged sites. The algae is irregularly shaped and dark, mirroring the irregular pigmentation and borders of Lentigo Maligna. The algae floats on water, signifying Lentigo Maligna's long horizontal growth phase. Bob Marley with a dark spot on his palm symbolizes Acral Lentiginous melanoma, the type that affected Bob Marley. He has dark skin tone to remind us that this subtype is the most common melanoma in darker-skinned patients. His black nail and Hutch shirt highlights nail matrix melanoma and the Hutchinson sign. The disco dancer represents Desmoplastic melanoma. The $100 bill is not just for those expensive moves. It also indicates that Desmoplastic melanoma is S100 positive. The funky socks signify SOX10 positivity. And the broken melon with an A reminds us that Melan-A is negative. The dead hummingbird illustrates it is HMB45 negative as well. The woman with the watermelon stuck in her mouth introduces Mucosal Melanoma, most commonly affecting the hard palate. She's holding a stopwatch to emphasize the importance of early diagnosis for mucosal melanoma, as half of them metastasize. The 21-year-old spitting a watermelon symbolizes Spitzoid melanoma. The 9-shaped straw and 21 on his shirt represent the homozygous loss of 9p21 in Spitzoid melanoma. The sad fish thrown overboard indicates a poor outcome associated with this mutation, which is detected by fish. Gina with the GNAC snack represents GNA11 and GNAC mutations. The eye drops point to an association with uveal melanoma. The bat reminds us the high risk of metastasis with BAP1 loss. Her pet blue crab symbolizes the association with malignant blue nevus. I'm getting kind of seasick. So, as the ship docks and we step back onto solid ground, remember, the best souvenir from any journey is knowledge. And this trip has given us plenty to bring back home. Now, time to hunt for some treasure and some Dramamine.